Good morning again, ladies and gentlemen. Today we come to part 2 of health promotions. And the learning outcome of today is at the end of the lecture, you should be able to illustrate the common risk factor approach as a holistic approach to resolve oral health issues. Second one, illustrate locus model of oral health care. And third one, prepare posters for oral health promotions. Fourth one is organize oral health screenings at medical camps organized by NGOs. And to illustrate health-related quality of life measures. Okay, this is a common risk factor approach. This is the Pedersen's model of common risk factor approach. All right. And this is also a common risk factor approach. You see it in different ways, where there is a political environment involvements, poverty, physical environment, and social environment. Okay. Risk factor consists of diet, stress, hygiene, uncontrolled hygiene. Okay, diseases consist of obesity, cancers, heart disease, respiratory disease, dental caries, periodontal disease, and trauma, while the risk factors are the tobaccos, the alcohol, and the good one is the exercise and the injuries. This is also another model of common risk factor approach. Okay. This is another common risk factor approach, or it has which is linked with many medical conditions. Alright, links with anxiety, poor self-esteem, poor appearance, decreased quality of life, poor nutrition, and poor growth. Oral ill health also linked with carcinoma, linked with xerostomia, and radiation therapy. Also linked with premature birth and low birth weight. It also linked to smoking, increased cost to society, disease repair is expensive, and prevention is cheaper. And it also have linked to decreased productivity, lost work, and school days. Okay, key points. The mouth and body are integral to each other. Recognition that oral health and general health are interlinked is essential for determining appropriate oral health care programs and strategies at both individual and community care levels. Oral health shares common risk factors with other chronic diseases or conditions. The adoption of a collaborative or common risk factor approach, which addresses common risk factors and their underlying social determinants for oral health promotion, is more resource efficient and effective than a targeted disease or specific approach. Okay, common risk factor, example, diets high in sugar and fat, low in fiber, and essential vitamins are associated with conditions like coronary heart disease, stroke, obesity, diabetes, cancers, and dental decays. Okay, on the other side, smoking is implicated in many diseases: cancers of the lung, throat, and mouth, coronary heart disease, diabetes, and periodontal disease, other diseases of the soft tissue of the mouth. Common risk factor approach again. Another factor is alcohol. Drunk in large quantities, increased risk of general conditions, high blood pressure, liver disease, coronary heart disease, cancers of the mouth, social problems, and violence often result in fracture of the jaw and teeth. Another uh, model of Ottawa Charter. We have discussed this before. Now we touch again on a more detailed aspects of the 5 pillars of the Ottawa Charter. Okay. Building public health, a healthy public policy, health promotion policy combines diverse but complementary approaches. Okay. Health promotion policy combines diverse but complementary approaches. Is coordinated action which leads to health, income, and social policies that foster greater equity. Okay. Health promotion policy requires the identification of obstacles to the adoption of healthy public policies in non-health sectors and ways to remove them. Food and health policy to reduce sugar consumption, community approach to improve body and oral hygiene, smoking cessation policy, policy on reducing accident, policy on water fluoridation, and policy of reducing accident, policy of water fluoridation, ensuring access to appropriate preventive measures. All right. Second one is creating safe environment. I think all this you can read and you can understand easily. So I'm not going to go through every single piece of this. Okay. Third one is strengthening community actions. Community development draws on existing human and material resources, okay, to enhance self-help and social support, to develop flexible system for strengthening public participation in and direction in health matters, requires full and continuous access to information and learning opportunities for health as well as funding support. Fourth one is developing personal skill. Increase in information and educational skills is essential. Okay, enabling people to learn, prepare themselves for all of its stages, and to cope with chronic illness and injuries. This has to be facilitated in schools, home, workplace, and community settings. Alright. And the fifth one is reorienting healthcare services. Okay. The role of the health sector must move increasingly in a health promotion direction beyond its responsibility for providing clinical and curative services. Okay. Okay. Healthy public health policy. Some of these examples that you can get for public health. is implemented right now. Oral health promotion with children and adolescents, effective oral hygiene, restrictions of food containing sugars, and continuous use of fluorides. So then we have the differing approaches. You have health field concept. Okay, that is Mark Lalonde. Prime Minister of Canada in 1970 introduced the health field concept, equal access to equal care for all citizens through public financing. Second one is Rolandi's observation. They has not, this has not improved health status of the people. Okay. The health field concept is a conceptual framework for the evaluation and analysis of community health needs that includes assessment of human biology, environment, lifestyle, and healthcare organization. Today, we see the importance of other factors such as the environmental movement, lifestyle provided by 1000. Today, we see the importance of other factors such as the environmental movement, lifestyle choices, recreational facilities, biking and walking trails, open space and things provided by the community rather than individuals. Okay, 5 different approaches to health promotion. That is the preventive, behavior change, educational, empowerment, and social change. Okay. Oral health examples could include preventive measures such as vigilance or the establishment of screening programs for oral cancer detections and preventions. The limitation to it is it does not address the underlying causes of the disease. Therefore, new cases will constantly arise and require attention. Okay, behavior change. This approach aims at encouraging individuals to take responsibility for their health and adopt healthier lifestyle. It is largely based on assumption that provision of information will lead to a sustained change in behavior. It is an expert-led approach utilizing a range of methods including mass media campaign. Okay. Desired changes in lifestyle are determined by the professional and largely imposed on the patient. Health education advice provided by dentists within surgeries aim at improving oral hygiene practice in an example of this approach commonly adopted by dental professions. Okay, third one is educational approach. One is to make informed choices about their health-related behavior. People need not only know but also the skill and attitude that support this information. Okay. The educational approach aims to provide individual with this. However, unlike the behavior change approach, it does not set out to persuade a person to change in a particular direction. Rather, it is attempting to provide individuals with choices, which they are then able to act upon as they choose. Okay, this is some of the approaches. Okay. The fourth one is empowerment. This aims to assist people in identifying their own concerns and priorities. and in developing the confidence and skill to address these issues. Unlike the other approaches, empowerment is essentially a bottom-up approach in which the health professional acts as facilitator. Okay, social change. This approach acknowledges the importance of socioeconomic and environmental factors in determining health. It therefore aims at changing the physical, social, and economic environment to promote health and well-being. So to achieve this requires changes in policy and political support. Lobbying and policy planning are key elements. Okay, professionally led preventive approach, behavior change, individual focus, educational approach, and empowerment. Okay. Okay. Student, this is all that I need to say about promotions. Oral health promotion part 2 and